Hey everyone, thanks for tuning in and thanks to Eyes on Eye Care for hosting this. Welcome to the TearCare System Implementation Masterclass. I am Dr. Alana Keller and I work at a practice called Clarkson Eye Care in Wildwood, Missouri. Because I have the TearCare system, I'll be referencing that, but honestly, any device, all the content will be relatable to the implementation of any of the devices. I don't work in a strictly surgical practice and I don't work in just a dry eye clinic. I'm simply an optometrist who saw a growing problem with dry eye and found a way to treat my patients more effectively. And that has included over 600 TearCare treatments. So I believe that dry eye disease is the most underdiagnosed and undertreated disease in optometry today. But I do think it's something that we have the ability to turn around if we're really equipped with the right tools and take the initiative to identify these patients and treat them appropriately. Studies indicate that about 1/3 of our patients that come in have dry eye disease or dry eye disease related symptoms. And if your patients are like mine, I would say that that number is quite low. I would say most of my patients that come in have a sign of or a symptom of dry eye. And we know that 86% of those dry cases are MGD. So we should be providing treatment to unclog those glands. Some of you may have a different device, but I chose TearCare because it's a relatively inexpensive system and it uses manual customized expression. So manual expression is key because, as you know, there's not a one size fits all with the eyes. So there's going to be some areas that you're going to have to kind of go over that are more stubborn. And so, for example, like if you had a non-acute hordeolum, you're going to have to go over that area multiple times to completely drain it. So this is just showing how these smart lids conform to the eyelid anatomy and allow a patient to blink normally. Well, this is beneficial because it takes advantage of the body's natural mechanism of expressing that meibum through blinking, and it doesn't interrupt their day. So a patient can still be on their computer or work if they need to. So what is the TearCare system? Well, it's comprised of the smart lids and the smart hub. They are on a continuous feedback loop to maintain a temperature of 41 degrees to 45 degrees Celsius for a total of 15 minutes. And that's the ideal time and temperature you want to melt that meibum. I like that it's highly portable. You can, patients can stand up or they can sit back and relax. And then you have the clearance assistant device. I really like the one that they provide. You can do precise gland targeting with it. So it is supported by the literature. It's one of the most studied MGD devices. There are currently 6 peer-reviewed papers out and counting. And if you want to read up on any of that, just scan that QR code to do that. So why TearCare? Well, as we discussed before, it is cost efficient. It doesn't take up a lot of room in your practice. It's highly published and it's clinically effective. So I knew it worked from the studies, but I also saw impressive results in my own clinic. So the first patient I did, she had come back in stating that she didn't think she needed her contacts any longer because her vision had gotten so much better. And then the second patient I did, it was a similar response. He wanted me to double check his vision because he thought his vision had changed for the better. Well, I continued to see patients like that. And that was a really big eye opener for me because oftentimes we hear about fluctuating vision with dry eye, but it's not really talked about when you get that constant blur. And And a patient's vision, they might come in and want to have glasses, to have a remake for their glasses, and it's really just that dry eye. So it's also user friendly. It's very easy for our staff to use. They're easily trained, and it honestly only takes about 5 minutes in the practice to do it. So when we talk about the fundamentals, identify, diagnose, educating, and treating. So these are some of the things that you want to have in place. You want to identify patients through a speed questionnaire or a dry questionnaire. I personally like the speed questionnaire because it incorporates a few extra symptoms that the other ones don't incorporate that I usually see with dry eye patients. On any perioperative patient, you're going to want to treat that ocular surface and make sure it's healthy before sending them out for surgery. During the exam, you want to pay attention to the tear breakup time or the gland structure and function. So for the function, you're just going to use a cheap, easy tool of your finger, and you're going to press on the lower nasal glands to see the quality of meibum and see what the function is. I would say having a meibographer is pretty helpful, but it's not necessary because I did not have one. And I had done a number of treatments. You're gonna want to have a script, you and the staff, so that you can feel confident with any of these fundamentals. And the more you present it, the more confident you are, the more comfortable you are, and it just gets easier with time. So I'm gonna take a minute if all of you can pull out your phone and scan that QR code, we'll go ahead and do a speed questionnaire. For those of you who have never done one before, this will just show you how easy and fast it is to do. So give that a minute or so. So that wasn't even quite a minute, but you might be surprised by your score. So 1 to 4 is mild, 5 to 7 is moderate, and 8 or above is severe. And, you have to have this as baseline measurement. I use it for retreatments or follow-ups. I especially like to show a patient their score to show them how much it's improved. Or sometimes if a patient doesn't get a treatment, they skip their 6-month treatment, for example, and they'll come back for their yearly annual eye exam, and I will have a speed questionnaire. Well, I'll show them, hey, your numbers are starting to creep back up. I think another treatment is necessary, and then they're on board. So moving on to educating and diagnosing, this is a script that you can use. Now, because I use TearCare, I'm going to recommend that to clear any obstruction. With the script, I really like the visuals for patients. And I honestly like the picture there. I use that handout. I have it in all of my exam lanes to educate my patients. And if that is something you're in need of, don't hesitate to contact me and I will get that for you. And also don't be discouraged by no's. You are still planting the seed. Patients are going to go home and they're going to start to think about it and think about their symptoms. And it's not uncommon for them to come back the next year and say, hey, I can't deal with my symptoms anymore. I need a treatment. So because MGD is a chronic progressive condition, I never feel like I'm wasting my time educating the patient. So you want to have a script, you want to know your script, and confidence is key. So let's move on to the top 10 must-haves from the top 10 TearCare users to be successful with TearCare. Now, again, this works for any thermal expression device. So number one, it's a mindset. Dry disease is massively prevalent. Describe the patient as not having dry versus looking for it. So most patients aren't going to come in and tell you they have dry eye disease. It's just not something they equate to having. So, you know, if they have irritable eyes or fluctuating vision, they're just going to think that's normal, or their symptoms aren't noticeable until you happen to bring it up, or they might just equate it to allergies. Create a process that flows well and start with the collection of dry eye disease questionnaire and one dry eye disease sign, or that would include tear breakup time or meibomian gland secretion score. And then set the scorecard. You know, not every treatment results in a wow moment. You want to track and measure improvements. And this is why number 2 is so important. So some patients truly forget that their symptoms were so bad. So I like to incorporate a 1-month follow-up where I show a patient how much they have improved. And at that time, I will do another speed questionnaire and I will do a cold expression. During the cold expression, I'll tell a patient what I see. Some of the things that I'll talk about, I'll just say something like, hey, when I'm expressing, it's a lot easier. So I know the function of the glands is improving. Or I'll talk about how the oils are a lot clearer, or even saying that the speed questionnaire has improved by 50%, because that reinforces the success of the TearCare treatment and it impacts how the patients view it. Okay, education. Script for the patient. Get confident in your words, keep it short and sweet, don't overeducate. So too much information can be overwhelming for a patient, and that's why I like the handouts. It helps a patient retain that information and they can understand it more. Staff has to be educated. You want to explain why you bought it, and they need to experience TearCare. So as far as, you know, with the staff being educated, patients are going to come in, they're going to have questions. And if a staff is able to experience the TearCare, they can better explain to a patient why they're getting it, what it entails, what to expect. And honestly, Sight Science does such a great job with training your staff. If you're unable to, they will connect them with another dry eye consultant that will coach them and educate them on what to say. If needed, have your not covered by insurance script and examples ready. So there's always going to be a patient that will say, why doesn't insurance cover it? And so I like to use the example of hearing aids. You know, insurance doesn't cover hearing aids. Sometimes I'll say, well, Medicare doesn't cover glasses, or I'll use my own example of my migraine medication isn't covered by insurance, or you can just simply say insurance hasn't caught up with advancing technology. So you want to lead with scheduling same-day procedures, period. Patients are more likely to keep their appointments if they do it the same day. It's kind of like with glasses, patients that get glasses that same day are more likely, or have that appointment, are more likely to get their glasses the same day, as opposed to if they say that they're going to come back later. And some of the reasons why is they might think that they're too, the cost might get into their head. They might talk to other doctors, or they might Google it and think that, a warm compress will do the trick, or it's just not necessary, but based on the prevalence of MGD, you should be able to find someone that morning, and schedule them maybe at the beginning of your lunch hour. And that way you're capturing them the same day. And you're also giving yourself enough time to work out any kinks, and it doesn't interrupt your patient flow. So I'll recommend that for any doctors that are starting out. It's also a solution to no-show patients or last-minute cancellations. That will allow me more time with the patients that are there to educate them. And I'll say something like, hey, we just had a cancellation if you want to do the treatment now. But honestly, when I'm presenting it to patients anyway, the first thing that they'll say is, can we get that treatment now? So manual expression technique is tied to efficacy. Elevate your skill set. So there's peer-to-peer groups and webinars and resource videos, which we'll talk about in a minute. But this is such an important point, because I have had doctors think the treatment didn't work because they were doing the expression incorrectly. And so that's something that, we can coach you through. We can do one-on-one calls. You also want to explain as you're doing it to the patient just what you're seeing, because they want to know it worked. Some of the recommendations I have with expression, you're going to do a first pass, and sometimes you're not going to get any meibum out, but don't be discouraged, because the glands aren't all active at one time. And so that's more you're activating the glands. And then that second pass, you'll be surprised at how much you get out. I also like to do a milking technique where I start a little bit closer to the fornix, and then I work my way up to the opening and get it out that way. If you're still not getting the meibum, then you might want to press and hold and count to 10, because that's a lot longer than you think. And eventually, if the glands are alive, the meibum will eventually come out, and it will look a little bit like sludge. So emphasize the importance of any post-procedure recommendations. So I talk to all my patients about lid hygiene and start them on lid scrubs. Doing that alone can give patients a lot of relief, just because they're not using their toxic makeup removers or creams or soaps. And it has these antimicrobial properties in it and softening products. I kind of compare it to the dentist. TearCare is the deep cleaning of the teeth. It's the deep cleaning of the glands. And then you want to follow up with cleansing the eyelashes, just like you would brushing the teeth. And the more often you do it, the longer we can spread out those treatments a bit longer. And then test and learn, try, fail, try again, fail again, and fail better. So I'm still tweaking things that I've learned just from my own experience. And I really like a quote by, I'd heard recently from Dr. Steve Vargo, who said, comfort is the enemy to change. And so when it's just easy to do things that we're used to, but when you really identify, diagnose, educate, and then as I've incorporated TearCare, I feel like I've elevated my level of care and just felt a lot more rewarded at my job. So remember, don't let hearing no from one patient stop you from offering it to other patients who need it. So it's a no for now. Move on and continue to offer it to those who need it. And then celebrate those short-term achievements and then set yourself up for some long-term goals that are achievable. So I will say one of the common obstacles I see are that practitioners tend to overthink or just constantly think about the cost to a patient. And we're not like that with glasses or contacts. You just want to be able to go in and identify a disease and then present the best treatment options regardless of cost. You know, orthodontists don't think about the cost of braces and say, oh, that's really pricey, so I'm not going to present it to a patient. And that's, you know, purely, well, a lot of times it's just cosmetic. And so this is the vision we're talking about. And if you happen to see the mybography on some of these really young kids, you can't help but do everything you can to preserve those glands and ultimately their vision. And that's what's, you know, why I'm so passionate about it. So don't judge a patient by what you think they can afford. You know, I've done this on a number of Medicaid patients, and you know, what's the one thing that they say they can't live without, and that's their vision. So a lot of people are already invested in their ocular health. And then don't spend extra time going over the price with patients. I don't do that, you know, with glasses or contacts. So I wasn't about to do that with this. Plus, I don't have that extra time. You do, however, want to have a dry eye coordinator that does it, and you don't have to hire someone just for this. A lot of people think, oh, I don't have enough staff, but we just had our opticians take on this role, and we kind of present it like an orthodontist office where we keep the patient in the room. The optician will come talk to them about TearCare, so it's kind of more personalized, again, following the orthodontist. And then when they're done talking about it, they'll go and sell glasses. So no need to hire more staff. I know we always talk about having a dry eye consultant, and that seems almost impossible, but I just used the staff that I already had. Okay, I will take a few questions. Let's see here. What lid scrubs double as great makeup removers? That's a great question. You know, I try them all myself. I do like Blefadex for those rosacea patients, especially if they're older with a lot of blepharitis. And it's a good makeup remover. Also, some patients will use waterproof makeup, and that's why it's hard to come off, but that is something I recommend not using. I recommend doing the non-waterproof. But I also like a product if they're sensitive to the tea tree oil in Blefadex. I also like Zocular. It's the ochre-based product. It might not have as much stinging. And then patients that are really sensitive, I do have those patients, just a regular organic coconut oil works. Okay, so rely on your scorecard when a patient says, I don't feel different. This is why the dry eye disease questionnaire and the one sign is critical. So finally, you know, I have purchased TearCare. So I know that there are a ton of resources available. There are open forums for doctors and staff. There are peer-to-peer how-to videos that talk about expression and talk about how to educate a patient. There's online peer-to-peer discussion boards, and there is a guaranteed TearCare promise. So I might be able to take a couple of questions. What is the average cost of a mybography machine? Oh, I'm not sure about that one. Think you could probably get one for 12,000 or so. Do you do lid debridement? Have you ever used? This question is, do you do lid debridement or zest prior to the manual expression? Sometimes I do. If you know, there's a lot of collarettes, that's not a bad idea. And I have not used Zest, but I've heard that's a great product as well. So thank you all for tuning in, and have a great day.